Hello and welcome. This is Health Promotion Practices Author Interviews, and my name is Arden Castle. Each episode, we will explore a recently published article and its author. This week, I'm joined by Cynthia Begay, author of Cigarette and E-Cigarette Retail Marketing on and Near Tribal Lands, which was published in January 2020. This episode is focused on the findings of her paper, which is just one part of a three-part series with Cynthia Begay. Tune into our other episodes to hear more about her and our other authors. So congratulations, you have recently published an article in Health Promotion Practice Journal titled Cigarette and E-Cigarette Retail Marketing on and Near California Tribal Lands. For those of us who are not as familiar with the article, can you give us a quick 2-minute summary?
Sure. So this was a smaller project of a larger project from the TCOR Center, which is a Tobacco Center of Regulatory Science. And this was the project 2 of that. So that was a retailer environment. And so what we did throughout the state of California was visit tribal lands throughout California, looking at tobacco retailer environments. So we did observational surveys, looking at how the cigarettes were displayed and kind of compared those to FDA regulations. And we also interviewed retailer employees to see, how are they receiving this new information from FDA? Whenever there's a new guideline that comes out, or maybe a new cigarette or tobacco product has been banned, and they gave us insight on how they receive that information. And for us to summarize why we wanted to do this project, particularly with this population, is that with tribal governments, it's a government-to-government relationship, and we wanted to respect the sovereignty of those nations and really hold the government accountable, to see if they truly are reaching our communities the way they should be. Because as we know, a lot of these tobacco regulations are to keep tobacco use down in our communities and address those health disparities in that way.
Excellent. Thank you for the quick summary. And why is tobacco marketing such an important proxy to measure tobacco use?
Yeah, so tobacco marketing, I think, for me, it really helps seeing it from the lens, too, of how is unhealthy food or junk food marketed to us? How is alcohol marketed to us? And you can really see it in different communities where it's heavily marketed. And looking at the disparity, it's not by coincidence, right? It's by design, by industry. And so I think with the tobacco retail marketing, it's really important because nicotine is so addictive. You look at even that Black communities having menthol targeting them and knowing that menthol is an additive that makes the nicotine more addictive. For our communities and the Native communities, we have such a young onset for tobacco use. Kids as young as 10 years old are smoking, and then they use our cultural ways as a marketing tool to market toward us. And so just the work that we do in tobacco control, especially in tribal communities, is trying to distinguish that even amongst our own community, looking at traditional tobacco use versus commercial tobacco use. And that's what we always talk about when we're talking about commercial tobacco is the cigarette, the e-cigarette, what is it, Juul, that kids are using now. And so, yeah, I think the retail environment or just the marketing is a big, big factor in keeping what we already know is unhealthy for us in our communities.
It sounds like a lot of work trying to distinguish, like you said, what is part of cultural value and what is simply just marketing. Things that we already know aren't going to be helpful for us. In a previous interview, we talked about community-based participatory research, and I'm curious, what kind of role did the community play in your research?
Yeah, so luckily I have such an amazing mentor, Dr. Claridina Soto. She's Navajo and Jemez Pueblo, and also an urban American Indian like myself. So it's just really great to work under a mentor who really understands community and our community. I just feel so lucky that we share the same community. And so her approach has been, we always have a community advisory board. We call them CAB for short. And we pick, leaders in the community who we're going to work with, folks that we can really rely on to, once we develop a survey, make sure it's culturally appropriate. Like I mentioned earlier in the first segment, is even though we're Native researchers, it doesn't mean I can go into any tribal community and impose what my views should be and how we ask the community X, Y, and Z. And my mentor definitely takes the same approach. So that CAB is very instrumental, in that. They also can help us strategize ways to do data collection. Where are the best points of access in their community? Because at the end of the day, we want to build community trust. We want the community buy-in because we're working with the community. And we always let them know this is for them. We're just a vehicle to get them to their solution that they know best. So for that particular project, they helped develop the focus group questions. We had an addendum to our retailer survey and observation survey, which is specific to tribal communities. So the larger project focused only in LA County. And for our observational survey, we did include tribally manufactured tobacco products and things like that, which is really useful for our city because some tribal communities only carried those products. And there wouldn't be products you would see in Los Angeles. They'd be very different. So it is very instrumental and gives us so many different perspectives too from other Native peoples.
I like how you touch on kind of this humility aspect as coming in as a researcher, even if you belong to a similar community, that once again, you can't come in and impose your beliefs or your belief system on another group of people, and really acting as a facilitator in the process. Talking about your involvement with the communities, what did recruitment of retailers and data collection look like?
It was unique. I think working statewide, there are several approaches in how you reach communities. So for an example, in Southern California and San Diego, we reached a chairman's association, and it's basically the chairman's kind of the equivalent of a president of a tribe. They all have their own group, and we met with them collectively to talk about our project and, let them know that we wanted to approach their communities and doing the survey and getting their agreement. Other ways we work at is Indian health clinics. So the Indian Health Service has different clinics in different tribal communities throughout California, and those are really good community hubs. So we've approached them in partnership because that's what, the community recognizes. That's where the trust is of the community. So we've done that on a lot of occasions. And then other community-based orgs, I think, is also a good way to approach the communities. And in some cases, we have had to approach tribal government, and get on their agenda, get on their meetings, and let them know that we were going to do our study. But we really try to hit it at all angles, because even if we do, let's say, reach tribal government, kind of like our government, they're not really providing direct services to folks. Folks aren't seeing them all the time. But if you do a community center or Indian health clinic where they are hosting regular programming and family nights and things like that, that's where the people are going to be. And we want to go where the people are so we can get the biggest representation possible. And the most important thing, I think, especially, I like how you touched on cultural humility, is we are not transactional. Our team, we're not those helicopter researchers who are going to come in and take the research and leave. These are lifelong partnerships. And I think that's where some folks miss the bar or miss the mark, is they want to, I want to work with Native communities because this topic sounds trendy. And then they go and try to do the thing and then leave. Well, what are you leaving that community with? And so for us, we know we're going to continue working with these communities for many, many years. I mean, for Dr. Soto and myself, this is our career, and this is what we want to do. And so I think making sure we foster and nurture this lifelong partnership is really, really important to us. So we've worked on several different projects beyond the one we read about for the paper, same communities and different subject matters, but the reception is really great. And we're really grateful to those communities for that too.
I like that you're coming in with this relationship building perspective. It's something that you want to acknowledge the actual individuals and be a part of the process and involve yourself in the community. I think that is really exciting to see, and this lifelong journey that we talked about previously, getting them the research that you find and trying to get through those paywalls and whatnot and get them the information that you're doing. I think that it just goes to prove how many ways we can still interact with these folks, even if your current research isn't necessarily on those topics anymore. I think that that's really important. I want to talk about a particular part in your article. You state pro-smoking norms and the availability of cigarettes may undermine the effectiveness of attempts to preserve or expand smoke-free areas in the casino. Can you explain what this means and what it means in the context of your findings?
Yeah, so with the government-to-government relationship and that sovereignty piece, there's a lot of amazing things that come out of it. We can give tribal governments the autonomy to help govern their people as they see fit, and I think that's really important. One of the things and one of the challenges that we have coming from a public health perspective, tobacco control perspective, is some of the casinos that are on tribal lands aren't smoke-free. When there's a a big movement to help make those casinos smoke free. So when you have those pro-smoking norms, and like I mentioned in the community, young kids starting to smoke, sometimes they still see it as a rite of passage because their parents, their auntie, their uncle, they're all smoking, and they too smoked when they were that age. Those pro-smoking norms are and can be harmful. And I know specifically with my tribe on the Hopi Reservation, part of our ceremony is to smoke tobacco and offer up prayer, but teaching kids what is the traditional way to do it and what is a commercial, habitual kind of way to do it, and distinguishing those things. So just as a side note, there is curriculum out there called Tobacco Use for Prevention and Education, TUPE, and that teaches kids what is the traditional use of tobacco and then comparing it to the commercial use. So you kind of have these mixed messages. So I think that's where the quote unquote pro-smoking norms comes from. And so pro-smoking is kind of a loaded term because, yeah, I mean, we do have still our traditional ways to uphold, and sometimes those traditional ways include tobacco, but pro-commercial smoking, I guess, is the angle that I'm talking about. And with casinos, it is hard because there's an intersectionality too of public health, tribes keeping their sovereignty, but also economic development, which is a real issue. And I think some tribes, this is their source of income. And so in order to have their casinos, I guess not putting smoke-free areas in the casinos will help drive up their sales for tobacco products, you know, I guess ideally to folks who are, you know, coming in from all areas, because it's not just tribal people who access the casinos. I think that's kind of where the delay is in making all the casinos smoke-free. But our work as public health researchers is really trying to convey to the community, like, you may not pay for it now, but we also have really high cancer disparities or cancer rates. And, you know, if your folks do have cancer, where are they going to get screened? Where are they going to get cancer treatment and things like that? So it's really just trying to convey the long-term issue of it. And I think just kind of in general too, tobacco use may not seem as trendy right now, you know, or may not be as much of interest because we all know smoking is bad and lung cancer is so far down the road, I guess, whereas people are more attuned to opioid overdoses and opioid use. That's the one that people have gravitated to most, and that's where the urgency is around. So just trying to make sure, yes, tobacco control is still important. Yes, having these regulations is ultimately, I just say at the end of the day, we have to think about our youth. We have a teaching about the 7 generations. We're working for the next 7 generations. And so what are we going to leave to those youth? And we don't want to leave these pro-smoking norms or continuing the cycle of young cigarette smokers. So it's a lot of intersectionality, but we just do our best to educate and then hope that our tribal governments are able to consider that in their decision when they're making their own policy in their areas.
Yeah, it sounds like there are a lot of different moving pieces, from the educational aspect to sovereignty to economic stability and things like that. And I like thinking generationally, what are we leaving and how are we making this better for young folks? And kind of going off of that, if someone were to take away one thing from your paper, what would you want that to be?
Well, I think, and I really want to give an acknowledgement and thank you to Dr. Rowe. She was just so amazing. The first draft we had looked completely different than the draft that ended up getting published. And she is just so gifted in what she does because she read our paper and she knew exactly what we were trying to say. And that's the part that she wanted to uplift in the paper. And I think for me, especially just starting out as a young academic, I'm just trying to follow the template, the roadmap, you know, whatever it is. Like, I have some numbers, let me report on them. But what she helped do with this paper and what I hope folks take away is the community aspect of it and really honoring the folks that we were working with. We aren't just doing a study on. And so in the discussion, we do really talk about sovereign nations. And when we gave our recommendations, we did them in a very thoughtful way. We didn't want to say tribes should do this or tribes will do this. Tribal governments need to do X, Y, and Z, because kind of like in my last response, it really is up to the tribal governments to take these things into consideration and choose what they need to do for the betterment of their people, but also with these other things that they have to balance in their governments and communities. And so I really like that our paper, we did the work that we did, we have the findings that we have, but really this is just for the tribal governments to think about what they want to do next and just give light and perspective to other folks who are reading that we really do need to consider and take seriously the tribal sovereignty aspect of tribal communities and really seeing that as a government to government relationship between them and the U.S. government.
Excellent. I think that your paper really digs into these bigger ideas, and I definitely recommend reading the discussion section of your paper. I think that it does a really good job of talking about the community and not coming in as like this top-down researcher that's going to tell folks the right way to solve these issues when they do know better than we do what they need and how to get there. Well, thank you, Cynthia Begay, for joining us today, and thank you all for listening in. If you'd like to find out more about our guest this week, you can reach her here and follow us on Twitter, LinkedIn, and Facebook for more author interviews. Thank you.